10 years since medical assistance in dying was made legal in Canada, Alberta is looking to set its own rules.
Our government is taking steps to protect vulnerable Albertans by prohibiting medical assistance in dying in Alberta for select groups.
The province says its proposed laws would prevent people under the age of 18 and those with mental illness as their sole underlying health condition from accessing MAID, as well as those seeking to make advanced requests for MAID at a later date.
When I look to Alberta, look, the provinces, Quebec has done fine-tuning on this, and the people of Alberta have an absolute right to self-determination. But when I look towards Alberta on this, my question is, what problem are they trying to fix?
None of the groups identified in Alberta's proposed legislation have legal access to MAID in Canada yet, though the federal government will have to decide whether it will expand access to those with mental illness as their sole underlying condition next year.
If MAID came into law for mental illness only, our committee talked at great length in the report about all the steps they would have to take. And it's going to be much more complicated than what it is at the moment.
It's discriminatory and creates stigma when we don't allow those with capacity, despite having a mental illness, to have the same options as the rest of Canadians.
Since becoming legal, more than 76,000 Canadians have opted to use medical assistance in dying. In 2021, MAID eligibility was expanded to include patients whose natural death was not reasonably foreseeable, though in 2024, less than 5% of those accessing MAID fell into this category. Most people who accessed MAID for that year were over 75 years of age, with more than 63% reporting cancer as their underlying medical condition. Heather, Yourex-West Global News, Calgary.